Good morning, everybody. Welcome to our February Safety Council. We have Nicole Smith with the Ohio Department of Health here with us today, and Steve Hanna with our BWC updates. So I will go ahead and turn it over to Steve to give us his latest updates.
Okay, we can go start with the slides. Good afternoon, everybody. Good to be back and talking to people in the good town of Worcester. Okay, go ahead, first slide.
Okay, do you have it?
No, I sent it to you.
Okay, yeah. Maybe it didn't share. Okay, hang on. Okay. Is it up now?
Yeah, thank you.
There we go.
The wonders of virtual consultation, I'll tell you.
Yes.
So, okay, hey, I'm Steve Hanna, and I'm glad to be back talking to the good people in Worcester. Worcester is one of my favorite towns. I kind of travel all over the state, and I love Worcester. It also has one of the best colleges in the country. So I'm glad to be here today. Kelly is off. And so I'm going to hit for her and talk a little bit about some of the things that Michelle's going to show us. So we can go to the next slide, please. Okay, right there is a, can you make that a little bit bigger, please?
Sure.
Okay. These are the virtual training class. There you go. Thank you. These are the virtual training classes that we have in March. Everything's pretty much done in February except one, and I'll show you at the end of the slides here. There's one that I want you guys to know about, but this is everything that we got going, and you can see we got everything going out from what it costs for workers' comp, the hazardous waste. There's some ergonomics classes. There's electrical safety. These are all done online. You register online and you sit wherever you're at and take the course, and you get credit for it for your ISSP or whatever the things that you're trying to get credit for, or if it's for your own professional development, that's even better. But this is what we got going on in March. And if there's any change to that, we'll let the Worcester Chamber know, and we'll get that information out to you. Next slide, please. Okay, now this is a webinar that I wanted to get up here. Now that's March 22nd, and I didn't know I forgot how many allied care employers that we had in Worcester, but this is safe patient handling, and it's really good. It's just for an hour. But they give you some really good tips in it if you're into handling people that need your help. So I wanted to tell you about that. That's March 22nd. It's from 11 a.m. to 12 p.m. And the good thing about these things is that they're not 3 or 4 hours long. They're an hour, and it's packed full of good information, not a bunch of gobbledygook that you do not need. So you should be taking advantage of these things. Next slide, please. One of the other things the state did, they got onto YouTube, and it's BWC YouTube, and you can go in there, and we have all kinds of short, what we call micro videos that we show. They're quick hitters, 15 to 30 minutes long. But if you'll look at what we have up there on the screen, everything that we have micro videos on, and I just took a snapshot on this one. Everything that we have on there is in the OSHA top 10 hit list that they're going to be looking for. And especially slips, trips, and falls. In the state of Ohio, 33% of the claims that we have are slips, trips, and falls. So it's a big issue. I don't know if it's because our workforce is aging. I don't know if people weren't watching what they're doing. Imagine that, or whatever. But it's 33% now. It's more than soft tissue injuries. So it's a big deal. But that's just a snapshot of what we've got in there. Pick and choose. If you have, say, a toolbox meeting or something, or a group meeting, These are excellent. They're good icebreakers. And again, they're not long, but they're packed full of good information for you. Next slide, please. Okay, and down on the bottom kind of tells you how, to get into that micro training. That's on the bottom there. But basically, all you got to do is go into YouTube, do BWC YouTube, and they'll bring all the videos up to you to look at, and then you can pick and choose. Next, please. All right, I know I got you guys on the edge of your seats. I can just tell, probably because I got a tie on today for you. But the High Safety Congress is going to be here again through March 9th and 10th. It's going to be done online again. And I will tell you that look for 23 for getting back to partying and going down to Columbus and having a good time, having good professional development, meeting people, greeting people, getting out in their network. I think in 23, we're going to have that back, and it'll probably be a 4-day event. That's going to be in March of 2023. But in 22, again, it's virtual. So I'll talk to you a little bit about that. Could I have the next slide, please? Okay. What they're going to do is online, March 9 to 10. They have over 1,000 participants right now. There's going to be educational system, the rating program credit, continuing education credits. There's going to be an online expo where you can actually go in and pick and choose things that you want to look at. And the things, some of the stuff that they're going to be talking about, you'll be able to download it and have it as a resource. It's not the way that I personally like to do business. I like upfront talking to people, listening to people, but this is what we have to deal with now. And they have done a really good job down there of pairing the stuff out that is not, I wouldn't say not worthwhile, but maybe not needed. It can be gotten through another source, but it's just basic, good basic information. And then that kind of finishing up, they're going to have a scavenger hunt, which I know absolutely nothing about. Last time I went on a scavenger hunt in college, I got thrown in jail. So I don't know what's going to happen here, but there is a scavenger hunt. So could I have the next slide, please? This is what this thing's going to look like. It's like one of your games your kid plays on TV. You'll have this screen in front of you, and with your cursor, you're going to be able to move around and pick and choose, go where you want to go. If you don't like where you're at, you get out of it. If you don't like the session that you're at, you get out of it. There's no fines or anything. Nobody's taking names, but you pick and choose what you want to see and what you want to go to. And this screen that you're seeing right now is how you'll do it. Okay. Okay. All right. Kelly wanted me to talk to you about this. You ever heard that song, Walking Like an Egyptian? Okay. Here's one for you. Walk Like a Penguin. And this is tied in. This is Kelly's slide, not mine. Okay. No, it's good. And it makes a lot of sense. What it's showing is it's talking about the center of gravity when people walk on ice. And this winter, there was a couple of weeks, that it was really bad out there. And I'm sure that there's people out there in the audience, that, took a fall. Right here is one of them. But right there on the right, it shows you how she's recommending that you walk on ice or heavy snow to kind of prevent that slip and a fall. But she calls it Walk Like a Penguin. So you can take a look at that, and maybe you can hum a tune for that too. So, okay, let's go to the next slide, please. All right, this is on cold. Okay, keep warm. Know the signs of hypothermia. I know the older I get, the colder I get. And one of the things that causes that is not eating. And I'm sure that our speaker is going to talk a little bit about that, the importance of that. But she also put down on the, on the lower end there, something about the home supply, your heat. You want to check that, make sure that is correct. We recently had a death down in where I'm from, down in West Virginia, where we had 5 people lost their lives because of carbon monoxide. So it's something you keep in mind, especially if you got children. You see little kids running around with red cheeks. That's a sure sign. that your CO is in your house is not good. So just there's some tips there on the Colt. Next, please. Okay, now, this is something that's dear to my heart, our grants program. This is my specialty area. Maybe some of you guys have done safety grants for. I've done over 600 and about $20 million. So I probably got some of you guys. I know I got all the fire departments. So, but we have our grant program. 4 out of the 5 are up and running. Now we got the trench safety grant. All right. Now, if you're in construction, if Worcester, the city of Worcester is listening, or some other contract, if you need a box so your people can get into the ditch and trench box and do that work safely without worrying about a cave in, you know, the BWC will give you money to help get that. And that program is up and running, and I encourage you to take advantage of that. We got the Firefighter Exposure to Environmental Elements grant. That's, you know, our firefighters, if they go out and they're exposed to carcinogens and all the other crap that they get into, you know, protecting us, BWC's has money available for fire departments to have cleaning equipment, better change out clothes, so that they don't carry that stuff back to the fire station, or they don't take it home and they get themselves away from it. So that's our environmental protection program for firefighters. This one right here is really special for me, and it is not used as much as I would like to see it. And that's our Disabilities Grant. If I have a school system that's listening, or, you know, some maybe a nursing home, or some employer that takes care of people that have a developmental disability, the state, the Bureau will give you money, a grant, the regular safety grant, to get equipment to help your employees to provide the care to them and do it safely with the correct equipment. And that school systems, I know school systems are out there that have to deal with this every day and are not taking advantage of it. So it's a good thing. We have to take care of our children, especially the ones that you know, are needing some help. So take advantage of that. And if you got questions on that, call me. I'll be more than glad to give you to help you with that. The next one is the School Safety and Security Grant. That's one of the best things we ever did. If I still had my children, my little boy and my little girl, if they were still in school, and I knew that the state was offering a grant to improve the security for the children and the teachers and the employees in that building, I'd be wanting to know if the school was doing it, and if they didn't, why not? And it's free money. You don't have to pay it back, but it's to make our schools safer. And I think that's a great thing, that you have a state agency that will do that will help keep our kids safe, our children safe. Okay, the last one is, and probably the one you're more interested. That's okay, you're fine, it's fine. The last one I want to talk about is a regular safety intervention grant program. That's the one that I was really heavy into in Worcester. I will tell you that program is on the back burner for right now, but I expect in June or July that they're going to have all the changes completed, and that program, that grant, will be available again. Now, here's the thing. Everybody knows what's going on in our world today. And I will tell you, 29 years working with this state agency, any type of programs that we have, that we give money back or we fund, the amount that we're allowed to do that depends on the economy in the United States. When I first started with the Safety Intervention Grant Program back in 1999, it was a 4-to-1 match. And it went like that for years, and then it went to 3-to-1. And then when the economy went bad, it got to 2-to-1. So I do not know what the match will be when it comes back in 22, but it'll be something. And I'm hoping it's still a 3-to-1. So the SIG program, look for it to come back this summer. And Kelly and I will be readily available, to help out the people in Wayne College. Okay. Here's another one that I wanted to put in for private employers, important dates, February 28th. This is your policy activity rebate enrollment deadline. Now, I don't get into that stuff, and I really don't know what that means, but I know it's important for the administrative people that handle all the business stuff with the Bureau. So I wanted to get that out there. March 31st, the Drug-Free Safety Program annual report is due. All right. And then the one claim program and 100% EMCAP education requirement deadline. Those two are all due on March 31st. So if you're into that, those are your deadline dates that you need to be looking at. Public employers important dates. This was February 15th. February 15th was your payroll tune-up was due for 21. Okay. March 1st, the Drug-Free Safety Program Safety Action Plan for advanced level participants. Though that is March 1st. So if you're into that, there's your there's a deadline for you. All right, BWC consultation services. You know, they let us out of our cages. We're allowed to go out and do visits now. We still do we can still do the virtual with you. We can do the training. We're getting geared up again to really kind of, you know, hit the ground running here as soon as it warms up and we get the go ahead, you know, from our division head cards. But we are allowed to do on-site visits, and my contact information is on the bottom, and that is not 4215. My phone number is 904-4315. I apologize for that. So that's just about all I have. You know, if you got, you have the right to have a safe workplace. If you have new people, we have a lot of young, new temporary employees out there. Kind of keep an eye on them. You know, watch their back. They can watch yours. We're all in this together. So it's been great talking to you guys. You know, please get a hold of me if I can help you. I really look forward to talking to you. And I have one more thing for you. The speaker today, I'm really interested in hearing what she has to say. I have diabetes on both sides of my family. I lost both my grandmothers to it. My brother has it. They tell me every time I go down and see my mother, she grabs out her box and sticks my finger, checks my blood to make sure my sugar is okay. But this is a very important subject that a lot of people don't know a lot about. So I'm really interested in hearing what our speaker has today. And I just want to say for myself, I want to say welcome to you, and to all my friends out there in Worcester. I hope to see you. Okay. Bye.
Bye. Thank you very much, Steve.
You bet.
Right. All right. And we'll go ahead and turn it over to Nicole.
Morning. Let me share my screen really fast. Okay. Are you seeing the slides or the notes?
I can see your slides.
Okay, perfect. Just making sure.
Yep.
Okay, I'm going to turn my video off while I'm speaking just to make sure my internet's working. Okay, so here we go. Thank you for having me today, and I'm really excited to share this information with you. My coworker and I have spoken to a few other safety councils over the last, I don't know, 6 to 8 months. So we're excited to share this information with you as well. So let's see. Okay. So these are just the key takeaways that we hope you will have after today's presentation. I'm going to take some time at the beginning here to talk about some of the data and the trends that we're seeing with both diabetes and prediabetes. And then I'm going to talk to you about the diabetes prevention program Some people are familiar with it and many are not. And then I am going to share some resources and tools that are available to employers and payers to explore the DPP a little bit further and see if it's a good fit for your organization. And then I'll also talk about the technical assistance that we have available through the Ohio Department of Health. So I really like this image here. For those that haven't really heard of what prediabetes is, it's exactly as it sounds. It's when your blood sugar level is higher than normal, but not yet high enough to be diagnosed with type 2 diabetes. So as this image shows, it's kind of that warning sign that your body isn't functioning as it should be, but you're not quite to that level of being diagnosed with diabetes just yet. Typically, unless individuals make lifestyle changes, though, a lot of people who do have prediabetes will go on to develop type 2 diabetes within 5 to 10 years. And so, like I said, it's kind of this warning sign that you should probably take some action and make some changes to get your blood sugar back down to that healthy, normal level. And diabetes in adults has increased at an alarming rate in the past 2 decades. And, we expect that the pandemic will continue to increase rates of diabetes in our country and in our state. So as many of you likely know, people who have type 2 diabetes are at a higher risk of serious health complications that include kidney failure, blindness, heart attack, stroke, and loss of toes, feet, or legs. And, these are the most serious complications that can come from type 2 diabetes. But they are also can be the most costly, especially for an employer and for an individual. And based on Ohio data, we also see a significantly higher prevalence of asthma, cancer, COPD, depression, high cholesterol, hypertension, and cognitive decline among people with diabetes compared to those who do not have diabetes. And we also know that people with underlying conditions such as diabetes are at a higher risk of COVID-19 complications. And they're also, still conducting research because we're still in the pandemic, but there has also been some studies to suggest that having COVID may kind of progress people from prediabetes to type 2 diabetes at a further rate, or a faster rate, I should say. Okay, so we're going to talk about the type 2 diabetes landscape here in Ohio, and then we'll talk about prediabetes a little bit more. So this data is actually from 2019, which is the latest data that has been analyzed so far. There are more than 34 million Americans that have type 2 diabetes. I'm sorry, 34 million Americans that have diabetes. The majority of those cases are type 2 diabetes. It's approximately 11% of the US population. And diabetes is the 7th leading cause of death in the US. Here in Ohio, in 2019, our rates of diabetes were slightly higher than the US average. There were 12% of Ohio adults who had been told by either their doctor, nurse, some other healthcare professional that they had diabetes. And the prevalence of diabetes among Ohio adults has increased steadily from 2011 to 2019. Back in 2011, approximately 10% of Ohio adults had diabetes. And as I said, in 2019, it was around 12%. When we look at diabetes prevalence by sex or gender, race, ethnicity, age, household income and educational attainment. The rates we have here in Ohio are similar to the US. We see some of the same trends. And when compared with other states in DC, Ohio had the 9th highest age-adjusted diabetes death rate in 2019. In certain populations, the death rate is even higher. So the age-adjusted diabetes death rate for Black Ohioans was 1.9 times, almost 2 times higher than the diabetes death rate for white Ohioans in 2019. So we already talked about the comorbidities a little bit earlier, and you likely know this if you're, if you've looked at your employee population, but diabetes typically doesn't act alone. Many people who have diabetes also have other comorbidities. So this is Ohio specific data, and we see the highest rates of diabetes and other comorbidities with obesity, arthritis, depression, and heart disease. So those darker lines are people with diabetes, and the lighter red, the brighter red is people who do not have diabetes. Based on the national cost statistics that are found in the latest diabetes statistics report, we also know that diabetes is an extremely expensive disease. It not only affects your employees' well-being, but can also affect the company's bottom line. It's the costliest of the 155 most common diseases in the country. In 2017, diagnosed diabetes cost the US $327 billion with a B. And that includes $237 billion in direct medical costs, and then an additional $90 billion in indirect costs, such as reduced productivity and absenteeism. Care for people with diabetes was responsible for 1 in every 4 US health dollars spent in 2017. And the average medical expenditures for people with diagnosed diabetes were about $16,750 per year. Sorry about that. And this is 2.3 times higher than the average medical expenditures for people without diabetes. And preventing prediabetes from progressing to type 2 diabetes can save an average of $2,671 in medical expenditures for each individual every year. Okay, so that was type 2 diabetes. Now we're going to talk about prediabetes. Looking at prediabetes, the CDC actually just updated their estimates and increased the number. They're now estimating that 96 million Americans, that's more than 1 out of every 3 adults, and likely a significant number of your employees have prediabetes. Most people do not know they have it. Prediabetes typically doesn't have a lot of the symptoms that type 2 diabetes has. You know, people talk about increased thirst and hunger and things like that. And prediabetes typically doesn't have those same symptoms, and most times doesn't have any symptoms at all. So many people don't know that they have it unless they're being diagnosed by a healthcare provider. So that's why continuing to do your annual physicals and getting those blood glucose checks annually are extremely important. And I'll talk about that a little bit more too. So here in Ohio in 2019, 9.5% of Ohio adults reported being told by a doctor, nurse, or other health professional that they had prediabetes. as I said, prediabetes is still significantly underdiagnosed. There are a lot of reasons for that. There is a prediabetes diagnosis code that healthcare providers can use. It's a few years old, but there aren't clinical quality measures and some other measures that there are, like for diabetes. And so a lot of times it's just not diagnosed at the same rate as diabetes. We're doing some work with healthcare providers to try and impact that and make sure that everybody who has prediabetes is diagnosed. But again, the CDC estimates that more than 1 out of every 3 US adults has prediabetes. So likely a few people in this meeting may be in that range if they don't already know it. And we'll talk about some of the risk factors in a few minutes as well. So similar to diabetes, prediabetes are also more likely to have some other chronic diseases. And you can see those here on this graph as well. Looking at adults with prediabetes, they were significantly more likely to be obese compared to those who do not have prediabetes. And Ohio adults who reporting having ever been diagnosed with prediabetes were also 1.5 times as likely to have depression as those who have not been diagnosed with prediabetes. And were also significantly more likely to report having arthritis, COPD, and heart disease compared to those who had never been diagnosed with prediabetes. So like I said, similar to what we saw with diabetes. Again, this doesn't mean that prediabetes causes any of these other diseases, but just that people who have prediabetes are more likely to have other chronic conditions as well. So this is a regional map of prediabetes rates in Ohio. Region 11 had the highest prevalence of prediabetes in 2019. Let's see, Worcester and Wayne County is in Region 5, and in 2019, the prevalence of prediabetes in this region was 7.2%. The range in prediabetes prevalence estimates across the state may be attributed to true differences in prevalence or differences in testing and identification of those with prediabetes among various demographic or geographic groups. Okay, so now we're going to talk a little bit about the National Diabetes Prevention Program and how it can help people with prediabetes prevent the progression to type 2 diabetes. And as I talked about before, when I had that image up of the stoplight, we really like to think about prediabetes as preventable diabetes. So like I said, it's kind of this warning sign. It's a fork in the road. You know, if a person makes some lifestyle changes and, you know, commits to a healthier lifestyle, then they can prevent the progression to type 2 diabetes. If someone does nothing and, you know, doesn't have support around them to make those lifestyle changes, then it's likely that they will progress to type 2 diabetes. So this program provides a lot of great support and help for people who want to make some changes and get their blood sugar levels back to a healthier level. So I wanted to mention this. The U.S. Preventive Services Task Force makes recommendations on their screening guidelines and things like that for health plans to cover. And they, in 2021, towards the end of the year, they updated their recommendation on screening for prediabetes and diabetes. And they actually lowered the age that they recommend starting screening for prediabetes and diabetes. Previously, the recommendation was 40 years of age. And the recommendation now is that beginning at age 35, adults who have overweight or obesity should be screened for prediabetes and diabetes. And that screening should begin at an earlier age for people who are from particular populations that have a higher prevalence. So American Indian, Alaska Native, Black, Hispanic or Latino, Native Hawaiian, Pacific Islanders. And that for people who identify as Asian American, screening should begin at a lower BMI. So 23 for those who are Asian American. And the task force also stressed the importance of offering or referring individuals with prediabetes to preventive interventions such as the Diabetes Prevention Program. And this recommendation did receive a B rating. And so we haven't quite seen all of the health plans, change their coverage guidelines for screening based on this just yet, but I will probably be able to share more information in a couple months. If you want to talk to your health plans and see if they've lowered the age for screening based on these guidelines or not. Okay, so the Diabetes Prevention Program. As I mentioned, it's a evidence-based lifestyle change program, and it's for people who are at risk of developing type 2 diabetes. And the program focuses on making sustainable lifestyle changes to help people achieve a 5 to 7% weight loss. So it's a fairly minimal weight loss that they are looking for participants to achieve, only 5 to 7%. Over the course of the entire program, which is about a year long. Unlike many other weight loss or risk reduction programs, the National DPP, which is what we call it for short, includes a full year of support from a trained lifestyle coach. And typically this is about 16 weekly sessions during the first 6 months, and then bi-weekly or monthly sessions for the second 6 months. And there's over 20 years of research to show that the diabetes prevention program can lead to a reduction in type 2 diabetes. I'm going to talk about that research briefly here. So the original research studies started back in 1996, and it was a randomized clinical control trial. 45% of the study participants were members of a minority or racial ethnic group. And study participants also included those older than age 60, women with a history of gestational diabetes, and adults with a first degree relative with diabetes. So those are some of the risk factors for prediabetes and diabetes. So they were including people who were at the highest risk of developing type 2 diabetes. And participants in the study were placed into one of 3 interventions. The first was a structured, intensive lifestyle counseling with the goal of lowering body weight by 7%. The second intervention group received metformin 2 times a day, plus just kind of basic advice on diet and exercise. And then the third group received placebo pills plus that basic advice on diet and exercise. At 3 years after the intervention, the participants who were in the structured lifestyle intervention group saw a 58% reduction in patients who progressed to type 2 diabetes compared to the placebo. And then during that same time period, the people who were in the metformin group saw a 31% reduction in patients who developed type 2 diabetes compared to placebo. So both the lifestyle intervention and the metformin group saw positive impacts a reduction in people developing type 2 diabetes, but the lifestyle intervention led to a greater reduction in type 2 diabetes. And then 10 and 15-year follow-up studies have also been completed and shown very similar results, that those who participated in the lifestyle intervention group still after 10 and 15 years had a lower incidence of developing type 2 diabetes compared to the metformin and placebo groups. And then since then, the diabetes prevention program has been translated into and studied in different populations, different delivery modes, and continues to show the positive impact of the lifestyle change program on preventing the progression to type 2 diabetes. So a little bit more about the details of the program. I mentioned earlier that the program is delivered by trained lifestyle coaches. Typically, it's a facilitated in group sessions, although that has changed, especially due to the pandemic and the transition to virtual and other kind of on-demand online programs. But typically group sessions, and the program emphasizes participant empowerment through a personal action plan. And then all of the diabetes prevention programs have to use a curriculum that is approved by the CDC. And they also submit data to the CDC every 6 months. This helps to ensure program fidelity and also helps the programs maintain their recognition from the CDC. All right, so just like with any other wellness type program, accessibility is key for participation. The program is offered in person, online, via distance learning, or through a combination approach. And I'll explain the differences between some of these briefly. So in person, just as you would expect, participants and coaches are in a classroom-like setting. A lot of in-person organizations are YMCAs, hospitals or health systems, nonprofits. Worcester Community Hospital is one of the in-person delivery organizations for the DPP here in Ohio. I know they did switch to virtual delivery for a little while, but I believe they've returned to in-person programming, or maybe doing a kind of hybrid combination approach. Online programs are delivered 100% online for every participant. And online programs are when participants log into a recorded course session at a time that is convenient for them. So it's not a live group class. It's kind of self-paced learning modules, or some of these are apps now, you know, that people go in and follow different milestones and different lessons on kind of their own time. But in comparison, distance learning is delivered by a trained lifestyle coach via a live classroom or telehealth. So this is more like the virtual version of in person. So this is a group class. It's just via Zoom or Teams or something like that, where everybody is kind of live virtually at a designated day and time. And then combination programs can be any combination of the other three. Online and distance learning have become increasingly important over the last 2 years, and a lot of our in-person programs in Ohio did transition to distance learning. Most of them plan to continue offering distance learning or combination methods in some way, but others have returned solely to in-person. So it really just depends. And we really encourage employers to think about offering either combination methods or a variety of different methods, because as you know, one size doesn't fit all. Some people really enjoy doing online or app-based kind of self-study programs, and some people want that in-person component, and some people are okay with doing Zoom calls. So it really just depends on the individual and their preferences. So there are a lot of options available for people to participate in the program. This slide shows just a sample of some of the curriculum topics. This is not all of them. Obviously, there are topics related to physical activity and healthy eating, but the program also focuses on stress reduction, coping with triggers, how and where to get support for these lifestyle changes, what to do when weight loss stalls, what to do, when you go out to eat, what to do around the holidays when a lot of those triggers are kind of everywhere around you. So it covers a variety of topics to really support these lifestyle changes. And again, the main goals of the program are 5 to 7% weight loss, and also helping participants to achieve 150 minutes of physical activity per week, which is the recommendation for physical activity per week. So this slide shows the program eligibility. Participants must be 18 years of age or older, be overweight, which is defined as a body mass index of 25 or 23, as I mentioned earlier, if the person identifies as Asian or Asian American. They must not have a previous diagnosis of type 1 or type 2 diabetes, and also should not be pregnant, since the program focuses on weight loss. And then participants must also meet one of the criteria listed on the bottom as well. They could have a blood test result in the prediabetes range within the past year. They would also qualify if they have had a previous pregnancy where they were diagnosed with gestational diabetes, or they could score a 5 or higher on the prediabetes risk test. And if you aren't familiar with the risk test, there is a link on these slides, which will be shared with you. But it's just a short questionnaire to help people identify if they are at high risk for type 2 diabetes. It just asks a couple questions about family history and things like that. So somebody just needs to have one of the 3 at the bottom, meet one of those criteria to qualify for the program. Okay, so we're going to talk about both employer and health plan coverage of the national DPP across the US and here in Ohio. So this data is actually a little bit outdated. This was about a year ago. As of January 2021, there were 28 states that provided coverage for more than 5 million people. This is for state employees and their dependents. You'll see Ohio is not noted on this map. However, as of July 1st of 2020, state of Ohio employees that are enrolled in the state's medical plan do have access to the diabetes prevention program for free through our wellness program vendor, which is Virgin Pulse. So we need to be added to this map. But you'll see that there are many states that do offer coverage for the program for their state employees and dependents. And the Ohio Department of Medicaid actually also just added coverage as of January 1st of this year. So very new, and we're still working with them on kind of rolling everything out and communicating the coverage, but that is a new win as well. There are also many commercial health plans that provide some level of coverage for the program. There are more than 100 commercial plans and employers across the nation that offer the program. And this is just a sampling of health plans that have a larger presence here in Ohio or surrounding states. One thing to keep in mind is that the coverage may be limited to specific books of business, specific clients, or geographic areas. So although it says, Anthem, well, that's not a good example because Anthem is across the across the state, but like Aetna, it says, there are specific states listed. In Ohio may have been added to this, but when we last pulled this list, Ohio was not on that list. But even for Anthem or Cigna, many of them may only be for fully insured employers or self-insured employers. They have specific restrictions typically, or it may only be for employers of a certain size. So if it's something that you're interested in, it's worth speaking with your health plan representative to see if it's something that they do offer and if it's something that your organization would, qualify for. Okay, so now I'm going to talk about some tools and resources that can help you learn more and see if it's a good fit for your organization. This first tool or resource is the Coverage Toolkit, is what we call it for short. It was started by the National Association of Chronic Disease Directors and the CDC several years ago. And it provides a lot of information and resources for employers and commercial health plans that are interested in covering the program. It also provides information about Medicare, Medicaid. There's a lot of information on this toolkit. So I wanted to highlight just a few resources that are for employers and commercial health plans. So this slide shows a few of those tools. There are some readiness assessments that an employer can take. There are actually 2 assessments to see, where they are in the process. Are they still kind of learning about the program? Have they developed a partnership with it, a diabetes prevention program? Are they ready to start covering it? It really helps an employer identify where they are in the process and what steps, they need to take to progress. There's also an FAQ document that outlines some of the common barriers to offering the program and responses or ways to kind of overcome those barriers. And then there's also a pathway to coverage document, which really walks through the steps from beginning to end of learning more about the program, all the way through, deciding to cover it and roll it out and communication and all of that. So these are some really great resources to check out as well. And then I mentioned before that there really is a lot of flexibility in terms of how the program can be offered and how it can be covered as well. So it can be offered as an insurance covered benefit if your health plan already covers it. It could be offered as a wellness or an employer offered benefit that is paid for through some other means. And then we talked about kind of the delivery modes, in person, online, distance learning. So there are a lot of options there as well. If it's offered in person, it could be offered through or at a community location, such as a church or at a YMCA. If it's offered in person, it could also be offered on site at the work site if the DPP organization is willing and able to do that. So this information is on the coverage toolkit as well, and just kind of provides some additional guidance on pieces and parts that an employer can think about when they're thinking about offering the program. Okay, these two tools are cost calculators, and they can be really effective tools for helping employers decide whether covering the program is a good fit for their organization and their employees, and can also help determine what the potential return on investment may be over the course of the next few years. So the first tool on the left is the CDC's Diabetes Prevention Impact Toolkit. This one can be used to project the health and economic effects of the national DPP on your population. There is an employer dashboard and an insurer dashboard. They're both pretty similar though. And I know this, the image here is pretty small, but this dashboard allows you to customize the data as much as you're able to. So if you have, employee specific data in terms of age, sex, and other risk factors, you can enter that specific data. If you don't have that level of data, then you can certainly, you can use state averages, you can use, they have industry or occupation averages that you could utilize as well. On the right-hand side is the American Medical Association's cost calculator, and this one looks specifically at medical cost savings. And this one, the image that we have up on the screen shows what the results look like after you've used the calculator. So it has the potential 3-year return on investment for this, fictional employer data, potential 3-year net savings. And then it also provides some information on, based on this employer, how many individuals potentially have prediabetes in the population. Of that, how many, or range of how many can you expect to enroll in the program? How many can you expect to complete it? And again, that all ties into what the potential return on investment and potential savings are. So these are really, really great tools. I actually encourage employers to use both of them and compare the results that you get, because they do give you slightly different results. And use these to help inform some decisions about the program. All right, so lastly, I wanted to talk about the technical assistance that we are able to provide at the Ohio Department of Health. We have good relationships with the majority of the existing organizations located here in Ohio that are offering the diabetes prevention program. Like I said, there are some offering in person, but then we also have some organizations that are located in Ohio, but offering either distance learning or online options. So we are willing and able to connect you with some of those partners if that's something that you want to explore a little bit further. There's also an option for employers to start their own diabetes prevention program. Typically, this makes more sense for a larger employer or, an employer that is willing and able to let other people from the community participate in the program. You just want to make sure that you have enough people to keep the program sustained over, several years. But we're able to help walk organizations through those steps if that is something that they want to explore. We can also help connect you with other online and distance delivery DPPs and third-party administrators. So I mentioned that the state of Ohio employees have access to this program through our wellness vendor, Virgin Pulse. There are a lot of other wellness vendors that also offer their own version of the diabetes prevention program. So some of the kind of more well-known names, I know Livongo, Omada, Lark, and there are certainly many, many more, but we're happy to put you in contact with those organizations too, if you don't already have connections there. Or if you are already working with some of those organizations on other wellness activities, you could certainly reach out to them and ask if they have a diabetes prevention program that they offer. And then, once employers decide that this is something that they want to offer, we can help them identify and recruit employees that qualify for the program. We can help them with communication efforts, connect them with other employers that are already implementing the program, and can also help employers define the reimbursement and payment structure particularly if it's not something that's already offered through their health plan. Okay. So what's next? I've covered a ton of information, but a few next steps that we've laid out for you. The first one is an employer market assessment, and I haven't mentioned this yet, but I can send the link to this to Michelle to include when she sends out the slides to you. But this is just a quick little survey for employers to complete. It just helps us understand interest in the program, and also tells us a little bit more about the employers that are interested in terms of how many employees they have, what their health plan is, what other benefits they may already offer, like diabetes management. Just helps us determine maybe what the best fit might be in terms of program delivery or program partners. So if it's something that you want to explore more, I definitely encourage you to complete this employer market assessment, and we can reach out to you. You're also more than welcome. My contact information is on the next slide. You're more than welcome to just contact me directly if it's something that you want to discuss further, or if you have questions. And then I also shared resources from the National DPP Coverage Toolkit. The link is included on this slide again as well. And then we talked about the cost calculators as well, which can be really great tools to help you kind of determine if this is a good fit. Okay, with that, I'm going to show my contact information. Email is preferred. So if you want to reach me, my email is right there. Are there any questions? Let me see if I can actually.
Yeah, I got a question.
Yeah.
Hey, how common is it, and maybe you touched on, how common is it for a person to lose like an upper or a lower extremity during when they have diabetes?
Oh, I don't know off the top of my head. I could find that for you. I don't have that statistic off the top of my head.
The reason I asked, I had one grandmother lost her toe, and then they had to take her leg, and she was heavily diabetic. And I was just wondering, is that a common thing or not common, or that's all?
Yeah. So that really depends on how well the disease is managed. And there is another, there are diabetes self-management education services and programs that are available for people who already have type 2 diabetes or type 1. And a lot of those programs and services they're typically offered through health centers or hospitals and things like that. But like I said, I don't have that statistic off the top of my head, but I could try and find it.
Okay, thank you. Thank you.
anybody else has any questions, please put them in the chat. We had one comment just said, thank you for the great information on a disease that is so potentially devastating.
Yeah, it was good. Very good. Very
Yeah,
good.
absolutely. And I mean, one thing, and I know a lot of employers are really thinking about this right now is, you know, a lot of people delayed their preventive care over the last 2 years, you know, during the pandemic. And so we kind of expect that we're going to see a lot of people who either have prediabetes or have already progressed to type 2 diabetes just because they, you know, haven't been doing those preventive visits with their physicians and haven't been, you know, getting the care that they need. So it's a really great time to focus on this while, you know, trying to focus on getting people back into their healthcare providers as well.
Yeah, definitely.
Hey, you know, you did make a comment about the pandemic. I would just say this, and I'm going to shut up. I had when the pandemic hit, we got our division safety and hygiene got pulled out of the field, and we went and worked for the Ohio Department of Health, and we worked retail undercover. And I'm sure that you're familiar with that. My territory was Wayne County and Holmes County, and I was predominantly more in Worcester than any other place. And I will tell you, Worcester employees did an outstanding job for the people of that town in keeping their businesses, following the rules. I mean, it was just outstanding. I didn't have to issue one citation. And I probably wouldn't have done it anyway. I would have given them a chance to get it cleaned up. But they were just very good. It was just outstanding. And the only problem ever was people just walking in without a mask, and then they jump right on them. So the businesses in Worcester, I want to give them a big pat on the back for their COVID response. It was outstanding, outstanding.
Good. Thank you. That's glad to hear that. Well, if we don't have any other questions, thank you very much, Nicole. You shared some great resources with us today, so we really appreciate that. And I just want to remind everyone that our next meeting will be March 23rd, and Nick Cascarelli with the Wayne County Health Department will be with us that day. So we will see you all in March.